Tini daba magari gari. Takajam, takadam, takarum, takanini daba magari gari. Rima padani tam, tadinginatum. Rima mabar, rima padani mapadani sa. Tatam, tatam, tadinginatum, tadinginatum. Rima ba mapada padani, rima padani mapadani sa padani sa di. Dari 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 daba daba magari. Rima padani mapadani sa padani sa rima. NavaDarshana.
Such a pleasure to meet you through this medium. Through this platform, NavaDarshana will bring to you makeup artists, physiotherapists, lighting technicians, so many different persons who are of great value to the dance community. Our first guest is Sheela, a brilliant physiotherapist. I had stopped performing for 4 to 5 years. I was not even practicing. So for me to get back to dancing was excruciatingly painful and a huge challenge. It is because of Sheela that I managed to overcome this challenge. She taught me about musculature, taught me to understand my body, my strengths, my weaknesses, to work around my injuries, to optimize my strength. And it is because of her that I dance today. This knowledge has been invaluable for me, and I hope you will find it useful too. Thank you.
Hello to everyone. Dancing itself is a vibrant activity and is considered equal to any other dynamic sporting activity. Dancers are similar to professional athletes as they go through a lot of wear and tear changes in their body. Therefore, it is important to understand the structure of the body, especially the muscles, the bones and the joints. This will help you to gain some knowledge about maintaining a good healthy balance between the muscles and thus providing a safe movement and prevent you from injuries. The main function of the musculoskeletal system is movement. It also helps in stabilizing the joints and maintain our posture. Let's do a quick review of the musculature of the upper body. Let's do a quick review of the anterior, that's called the frontal view, and the posterior, the rear view muscles of the body. We'll only be looking at the superficial skeletal muscle groups in the upper body. The major skeletal muscle groups forming the upper body are the abdominals, that stretches from your pelvic bone to the rib cage, and the pectoral muscles that forms the chest of the upper body, the deltoid, which is found in the shoulder region, and from behind you can see the trapezius muscle, the latissimus dorsi, and the triceps. We can also see here the rhomboids that are layered deeper than the trapezius muscles. Rhomboids play a major role in stabilizing the scapula along with the middle and the lower trapezius fibers. Scapula is the flat bone found in the posterior aspect of the upper body. This is also called a shoulder blade, and this bone connects the arm bone, that is the humerus, to the collarbone, that's the clavicle, and scapula, humerus and clavicle, all these three bones forms the shoulder joint. Let us discuss something about the posture today. Posture is the alignment and positioning of all the parts of the body with respect to gravity. When talking about the posture, it is better to know why a good posture is emphasized all the time. It is because a good posture helps to decrease abnormal wear and tear of the joint surfaces. It reduces the stress on the ligaments holding the joints of the spine together, helps in maintaining the good alignment so that the muscles are used properly, thereby reducing injuries. We can assess a posture in anterior, lateral view and posterior view. So when viewed the posture from the lateral side, you can imagine a plumb line passing from the head to the foot. The plumb line should cross the earlobe in the midline, and it has to cross the shoulder again in the midline and bisects the chest symmetrically, anterior and posterior, and it passes midway between the abdomen and the back, and it's slightly forward to the sacroiliac joint, that is the joint which joins the vertebral column and the pelvic bone. The line passes slightly posterior to the hip joint, slightly anterior to the midline of the knee, slightly anterior to the lateral malleolus, that is the foot region. Any exaggerated curve denotes abnormal posture. Now we can see the curvatures of the spine in the lateral view. The cervical spine is what you find just under your skull. There are three important curves we need to observe here: the cervical spine, the thoracic spine, and the lumbar spine. Cervical spine is what you find under your skull. It has got maximum functionality with respect to movement. Thoracic spine, it has got very limited movement due to the rib cage and the ligament extensions. The lumbar spine, it's a maximum weight bearing spine and it allows flexion and extension movements. There are a number of factors that contribute to the way our posture develops over time. Let's see how to analyze a posture. Shweta, can we see your anterior view? So let us take a look at the head and neck. We have to see whether there's a tilt or rotation in the neck to one side of the body. Generally, it happens that the head and neck muscles, if they are shortened, there is a tilt seen in these structures. Then coming to the shoulder level, we can see that her right shoulder is slightly depressed as compared to her left shoulder. This is probably because her right side is more dominant, causing a dip in the shoulder. The muscles supporting the scapula, that is the shoulder blade, they're also weak and are not supporting enough to hold the shoulder in its right position. A small shortening in one place can have an effect on all the directly connected muscle groups. So we can also notice the depression and shortening of her trunk muscles that further leads to a lateral pelvic tilt, and we see the right hip slightly raised than the left one. We can also observe here that her head is in slightly forward position. So the forward head position is considered to be an abnormal position because the muscles which are supporting the neck, they are not balanced. One portion of the muscles are elongated and causing undue stress over to the spine, and this may lead to neck pain, shoulder pain. Let us also look at a commonly observed posture deviation. So now we will discuss about the sway back posture. In sway back posture, you can see a forward head, shoulders rolled forward, stomach is pushed out, and there's an extension in the upper thorax and upper lumbar spine. In this posture, there is chances that your shoulder structures gets impinged because there's an abnormal functioning of the scapula stabilizers. Those muscles, that is the rhomboids and the lower trapezius and the middle trapezius fibers, they have to stabilize the scapula in normal position. But since they have got elongated and weakened, they are not supporting the scapula in position. And the pectoral minor, that will also pull, that gets shortened and pull the scapula more forward, which leads to the impingement of structures passing through the shoulders. Like you will have an impingement syndrome. The rotator cuff muscles, they get impinged, that the muscles cross the shoulder joint and gets inserted into the humerus. They get impinged in the shoulder joint. Let's look at how we can work on not only realigning and also some stretches and strengthen structures which helps in scapular stabilization. Now coming to the forward head posture. So Shweta, you have to tuck your chin, pull it little more behind. So comparatively, this is much better. I want you to do chin tucks, tucking your chin. Shweta, we can show it in the lateral view. You can hold the position, tuck your chin, take it more behind as much as possible. Hold there for 10 counts, stay there and then relax. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So this will help to reduce the stress on your head and also helps in maintaining the head in neutral position. We'll show some exercise how to strengthen the scapular muscles. These exercises are for rhomboids and trapezius. Rowing exercise. Shweta, can you keep your hands on your side? with elbows bent, I want you to roll the shoulders backward and downward. This is the position. It's like called scapula set position. All the upper back muscles, upper body muscles, you have to maintain this position and do the exercise. Now you have to move your hand forward and backward. Take it in a rhythmic manner and you have to maintain a tempo throughout the exercise. You can count 1, 2, 3. Take it behind. 1, 2, 3. Come forward. 1, 2, 3. Take it back. 1, 2, 3. Repeat this exercise for 10 repetitions, 3 sets. Throughout the movement, you have to maintain the shoulder position. You can't relax. The shoulder should not come forward and there's no purpose doing these exercise. The next one is stretch. We'll teach you the stretches for the pectoral, that is the chest muscles. You can either use a door or the wall. Keep your arm parallel to the floor and elbow in bent position. It's like an L shape. Now, Shweta is stretching her left pectoral muscle. Shweta, I want your left leg forward. Body is slightly diagonal in position. It's not straight. It should be slightly diagonal, facing away from the door. Yeah, now you can push your body forward. You have to do the stretch against an immovable object. Hold the stretch for 15 seconds. Any stretches, you have to hold it for minimum 15 seconds and 3 repetitions. You should feel a stretch in the chest region and then relax. We'll do some stretches for the head. Now we are going to stretch your left muscle. So take your left hand behind and use your right hand to bend your head to the right side. The ear should touch the shoulder. When you're doing the stretch, you should not lift the left shoulder. Hold the stretch in this position for 15 seconds. Repeat thrice. One more stretch for the levator scapulae. This is again the muscle which connects the scapula. Turn to your side, 45 degrees to your right side. Turn your head and use your right hand to bring the head down. Now the chin should touch the chest. Make sure your left shoulder doesn't lift up. Hold in this position for 15 seconds and do it for 3 times. This stretch will help you to reduce the tonicity of the neck muscles. So these exercises will help you to maintain an optimal position of the scapula.
I hope you enjoyed the first session, which concentrated briefly on the muscles of the upper body. The next session will be an overview of the muscles of the lower body. Thank you. See you next week.